So this patient's coming in today for an acute swelling underneath his chin. So this was developed, he had a little bit of a pimple that was there, and this sort of got quite a bit bigger very quickly. So typically, from an infectious standpoint, we usually look at either Staph aureus or group A strep, which will cause this to happen. And the question becomes here, does he have a little cyst underneath that got infected, or is it pure abscess? So the difference here being abscesses don't have a cavity, but a cyst will. So the other complication, which I've mentioned before, is this is all infectious, so this affects our anesthetic to a certain extent. So what we've done is he has a circumferential block through here, and then he has some anesthetic over here, which is why there's some blanching through here. So we'll hope to see if we can minimize that as much as possible. He may still feel some pressure, and that's unfortunately because the infection is impairing how well the anesthetic works. Now, how does that feel? Is that not too bad? Not too bad.
Can't even feel it, yeah.
Okay, good. So for these, because we're puncturing it, I use number 11 blade. And all I would tell you is this one's not too bad. It's below the angle of the jaw. But I would just tell you, keep in mind, again, the lines that we're looking at here, because I want to have a minimal scarring, I usually follow the angle of the jaw, but I want to be beneath it. Puncture here. So I have a garbage beside me, and you should always have a bunch of 4x4s, because this will want to ooze. You okay there?
Mm-hmm.
So a big debate here can be, a lot of times we just automatically put people on antibiotics, but the studies actually show that if we drain it, just the release of the actual infected material is enough that this clears. And you don't always need an antibiotic. And in fact, the majority of the time, you actually won't. So the other issue becoming here is, do we pack these or not? I've said before, if the times that I pack is if I don't have, you're okay there, it's not too bad?
Mm-mm.
If I can't break down loculations well or it's bleeding excessively, then I consider packing. If I can, however, I'll try and get around without actually packing these, because the packing doesn't improve healing at all and it's uncomfortable for the patient. So in this particular case, because the anesthetic's not bad, I'm going to see if we can get away without packing. So in those cases, and especially when we're dealing with pure abscess, which is what this looks like, I want to make sure I try and irrigate it. Because so this is just normal saline. And I'd be sensitive to the fact that this stuff, it can really be quite pungent, so be aware from the patient's perspective that if you can minimize how much you're spraying them with it, that would be good. And the last thing I'm going to do in this particular case is I'm going to use the longer Q-tips and just see if I can clean that out just a little bit more. You're okay?
Mm-hmm.
And this is again something that may seem obvious, but if you don't have good anesthesia, which you oftentimes won't hear, this can be too uncomfortable for the patient.
Yeah, that's the most I felt for sure.
Just there?
Mm-hmm.
All right, so now we'll just clean that up and dress it. You can see how the swelling's down. It should be good. That's it.